And this presentation will basically explore the relationship between living alone and mental health outcomes using Toronto census data from the year 2016. So introduction. Basically, this project will analyze and try to find if there's a relationship between rates of living alone and mental health addiction-related hospital admission rates in Toronto communities. My hypothesis is that elevated rates of living alone in communities leads to a higher prevalence of mental health-related hospitalization. In this, I use 2016 Toronto census data on hospital admissions and Toronto census data on housing conditions as well. In terms of methods that will be used to support the hypothesis, I will use regression tables, regression equations, confidence intervals, and null hypothesis will be employed. The simple regression will inspect the correlation between the two variables, and the null hypothesis will take a 95% confidence interval of the difference between the mean of the two variables I'll be using and explaining. If zero is not on the interval, then the null hypothesis will be rejected. So my methods. Firstly, I'd like to specify that my response variable is the mental health related hospital admission rate, and my explanatory variable use data wrangling to take the quotient of two different variables, the total population in private households living alone and the total population in private households. So basically, I imported the necessary packages, I merged my two data sets, and then I went on to create a scatter plot of the correlation between my two variables. And with the scatter plot came the simple regression line, the regression table, and the regression equation. And then for the null hypothesis, I used the bootstrap method to sample means from my population. I basically created a for loop that would take a sample of size 50 from my population based off of a variable I had created, which was above average living alone rates. Above average living alone rate would consider which communities had above average rates of living alone compared to the median and designate them as yes or no. This was a new column. So my bootstrap would take a sample of 50 and it would calculate the mean of each group, yes or no, and then take their difference and append it to a list. And this was done 5,000 times. And then knowing this, I was able to use the NumPy's dot percentile method to calculate a 95th percentile from 2.5% to 97.5 percentile. And my results, my results are here. Basically, for my correlation, I have the regression table. You can see that my slope is 13.28 and my y-intercept is 3. The regression equation shows that listed there. And then you can see from the scatter plot with the line of best fit that there is a strongly positive correlation line. And then coming to this is basically the distribution of the difference in the mean mental health hospital admission rates between communities with above and below average living alone rates. This is based off of my bootstrap mean list that I had created. I just basically created a histogram from this, and it was a sample size 50. The number of samples were 5,000, and this is close to a normal distribution with a median of 1.364. So my conclusion is that this project aimed to analyze if there is a relationship between rates of living alone and mental health addiction-related hospital admission rates in Toronto communities. Based on the regression plot above, from figure 2 and the slope of regression equation from figure 1, there seems to be a clearly positively sloping regression line for the correlation. In other words, higher rates of living alone among private households correlates with higher rates of mental health-related hospital admissions. Based on the slope, for every 1% increase in the living alone rate, the number of people admitted to hospital for mental health reasons increases by 13 per 1,000 people. So figure 3, based on the median, shows a clear difference in average mental health admission rates between the two types of communities I created, above average living alone rate and below average living alone rate. Our 95% confidence interval does not contain 0 as the possible difference, so the null hypothesis is rejected. We can say with 95% confidence that the mean difference in communities with above and below living alone rates is between 0.1 and 3 people per 1,000 admitted to hospital for mental health reasons. So the limitations of this study was there were confounding variables. It's an observatory study. We don't really control for our variables. So there are confounding variables such as age distribution in a community, income levels, and physical health levels. This study is also cross-sectional, so time might be a confounding variable. It's only taking into consideration data from a single year. A big limitation, though, is that my living alone variable does not precisely measure such. Instead, it focuses on living alone among private households. So other private household-related factors may further affect my study. So next time it would be wise to use panel data to take into account different years, and it would also be good to find a precise living alone variable and also to consider income of different communities in my analysis. That concludes my presentation. Thank you.